Welcome to our channel. Do you struggle with trauma? Maybe you know someone who is seeking help to work through past trauma. Today we're diving into the fascinating world of EMDR therapy. Whether you're a mental health professional or someone curious about therapeutic techniques, this video will provide you with a comprehensive understanding of EMDR. Let's get started. EMDR, or eye movement desensitization and reprocessing, was developed by Dr. Francine Shapiro in 1987. This innovative therapy was initially designed to alleviate the distress associated with traumatic memories, such as those experienced in PTSD. EMDR assumes that the mind can heal from psychological trauma, much like the body recovers from physical trauma. It challenges the notion that severe emotional pain requires a long time to heal, suggesting instead that the mind can process and overcome trauma with the right therapeutic approach. So how does EMDR work? The therapy involves bilateral stimulation, such as guided eye movements, which is believed to bypass the area of the brain that has become stuck due to trauma. This process helps in reprocessing traumatic memories, allowing the brain to resume its natural healing process. EMDR employs various techniques, including eye movements, tactile stimulation, auditory tones, and tactile taps. These methods stimulate both sides of the brain, facilitating the reprocessing of traumatic memories. Is EMDR evidence-based? EMDR is an evidence-based treatment particularly effective for post-traumatic stress disorder or PTSD. Numerous studies and controlled trials have demonstrated its efficacy in reducing symptoms of emotional trauma. How counselors use EMDR? Counselors use EMDR to help clients process distressing memories and reduce their emotional impact. The structured approach of EMDR allows therapists to guide clients through the reprocessing of traumatic experiences, leading to healing and recovery. What is the structure of a typical EMDR session? Remember, the goal is to promote the processing and healing of traumatic memories. Here's what typically happens during EMDR therapy. First, the therapist gathers information about the client's history and identifies specific traumatic memories or issues to target during therapy. Second, the therapist explains the EMDR process to the client, ensuring they understand what to expect. The therapist also helps the client develop coping strategies and relaxation techniques to manage any distress that may arise during sessions. Third, the therapist and client identify a specific memory to target. The client is asked to focus on different aspects of the memory, including the visual image, negative beliefs about themselves, and associated emotions and physical sensations. Fourth, the client focuses on the traumatic memory while simultaneously engaging in bilateral stimulations, such as guided eye movements, tapping, or auditory tones. This process is repeated until the memory becomes less distressing. Fifth, the therapist helps the client replace negative beliefs with positive ones. The client focuses on the positive belief while continuing with bilateral stimulation. Sixth, the client is asked to observe their physical sensations while thinking about the memory and the positive belief. This helps identify and process any residual tension or distress. Seventh, each session ends with a return to a state of calm. The therapist may guide the client through relaxation exercises to ensure they leave the session feeling stable and safe. Eighth, at the beginning of subsequent sessions, the therapist and client review progress and determine whether further memory processing is needed or new targets should be addressed. What training is required for EMDR narrator? To practice EMDR, mental health professionals must undergo specific training. This includes completing an EMDR International Association approved training, holding a valid license in a mental health field, and participating in supervised practice sessions. EMDR is not without critics. Here are some of the main points of criticism. First, critics argue that the theoretical basis of EMDR, particularly the role of eye movements and bilateral stimulation, is poorly understood or clearly explained. Some suggest that the eye movements may not be necessary for the therapeutic effects. Second, some researchers believe that EMDR's benefits may be due to the placebo effect. or the therapeutic setting rather than the specific techniques used in EMDR. Third, critics point out that while EMDR may be effective, so are other therapies like cognitive behavioral therapy. Fourth, the practices of EMDR therapy can vary according to the therapist and impact the effectiveness of the approach. Fifth, some mental health professionals argue that EMDR places too much emphasis on trauma and may not address other underlying psychological issues that contribute to a person's distress. Sixth, while there is substantial evidence supporting EMDR for PTSD, critics note that more research is needed to establish its efficacy for other mental health conditions. Despite these criticisms, EMDR continues to be a popular and effective treatment for many individuals, particularly those dealing with trauma-related disorders. Like other therapies, there should be a high degree of fit between the treatment and the client's needs. Conclusion: EMDR therapy offers a unique and effective approach to healing from trauma. Whether you're considering it as a treatment option or looking to expand your therapeutic skills, understanding EMDR can be a valuable asset. Thank you for watching, and don't forget to like, subscribe, and hit the bell icon for more insightful content.